In general, people understand the term genetics refers to our DNA and the genes within the DNA that encode everything from our biological characteristics to our risk of developing certain diseases over time. The term epigenetics is less well known, and this literally refers to being related to genetics or next to genetics, and practically that means the modification of the DNA itself. What do we mean? We're referring to the addition or subtraction of chemical groups like sugars or carbohydrates that, when added to the DNA structure, make the genes within the DNA more or less likely to be transcribed and actually used practically by the body. So a methyl group is one of those chemical structures, and DNA methylation alters the transcription of genes. Now, azacytidine is an agent that is used in the treatment of hematologic malignancies. It's an inhibitor of DNA methyltransferase, and this works by reducing DNA methylation, and this has practical implications in terms of genes being switched on or off. In mouse models, addition of this agent is associated with better activity of immune checkpoint inhibitors. Now the question is, does this approach actually work in humans? And that's being tested by a few trials, and this featured one in particular. Now, this study is what's called a phase 2 trial. It is for patients with stage 4 advanced lung cancer who have received prior platinum-based chemotherapy, and there is no requirement for PD-L1 expression. They are looking for about 90 patients, and these patients will be randomized to receive Keytruda, or also known as pembrolizumab, a PD-1 inhibitor administered IV, in this case at a fixed dose of 200 milligrams on day 1 every 21 days, with either oral azacytidine, an agent now called CC486, given for 14 days of those 21 days in the cycle, or a placebo in that time. So everyone will get the active agent Keytruda, an immune checkpoint inhibitor, and the question that is going to be asked is whether the addition of oral azacytidine can lead to what's called epigenetic priming and improve outcomes with immunotherapy. The primary endpoint of the trial is progression-free survival, looking for a difference in the time before the patients randomized to the combination develop progression of their disease after starting this compared to Keytruda alone. And if people are interested in this trial, you can follow the link at the bottom of the page. It should be an interesting trial that will help us better understand how to best treat patients with immunotherapy. Thanks very much.